we have to discuss some basic thing regarding your ribs. Okay. If you in the exam, if you fail to answer these things, then examiner must ask the classification of the ribs. Okay. So basically, how many ribs are there in our body? 12 pairs. Okay. So now the classification of the ribs. So according to the features. Okay. So first is classification of the ribs. So according to your features, the typical rib is 3rd to 9. Okay. So the typical rib having some similar characteristics. See, this is the features of your typical rib. Okay. What is the features? First is curved. They are curved, angulated, and twisted. What is the meaning of twisting or twisted? If you put it on your table, the ribs are not attached to your this surface. Okay, they are like lift off in the posterior rib. Okay, so this is the meaning of twisted. So first is the typical rib and atypical rib. So 3rd to 9, it is your mainly your typical. Okay, because it's having some similar features like it is curved, it is angulated and twisted. So what is the meaning of twisted? It is not attached to the surface of your table or anywhere you put it. Okay, but in case of the second rib and first rib, see here, if you put it on the table, they are the same line and they are attached to this surface. Okay, so this is the main features of the typical rib, and atypical ribs having some different features. Like first rib have some different features like second rib, then 10th, 11th and 12th. Okay, so according to your features, they are typical rib and atypical rib. By the attachment of the sternum, they are classified the true ribs and false ribs. So first 7 rib, 1st to 7 ribs are your true rib because they are directly attached to your sternum. Okay. Then 8 to 12 ribs, this is your false ribs because they are not directly attached to your sternum. Okay. See here, the typical ribs have the same general features like you can remember like this mnemonic cat: carved, angle and twist. And whereas the atypical ribs have some special features, means the first rib have some special features, then second, 10th and 11th, 12th. Okay. Next is according to the relation with the sternum. Okay. First 7th rib is attached to your sternum directly. Then 8 to 12 ribs is attached to your, do not attach to your sternum directly. Okay. So this is called your false rib. The next is your according to the articulation. First one is vertebrosternal rib, means first 7 ribs. You see here the first 7 ribs are directly attached to your sternum. But see here the vertebrochondral rib, 8 to 10th rib. They are attached to a sternum but not directly. They are attached to your 7 costal cartilage. So 8th, 9th and 10th ribs are together attached to your 7 costal cartilage, means upper costal cartilage. So they are named the vertebrochondral ribs, means 8 to 10th rib. Here you can see these 2 ribs are your floating rib because anteriorly they are not attached to your sternum, posteriorly they only attached to your vertebrae. So anterior end is free. So one general knowledge question: can anyone tell me which ribs are more prone to injury? Yes, floating rib because they are not attached to your sternum. And which 2 ribs are not easily get fractured? Yes, first and second also because the clavicle bones are present. Okay. So see here the vertebrosternal ribs are 1st to 7th, then vertebrochondral ribs 8 to 10, then floating ribs 11 to 12. So the vertebrosternal ribs are articulate posteriorly with the vertebra, anteriorly with the sternum, and the vertebrochondral ribs are articulate posteriorly with the vertebra, anteriorly their cartilage join the cartilage of the higher rib, means 7 costal cartilage. Okay. The next is your floating rib. Okay. So this is the features. Now this is basically the today's class, the second rib. Okay. So basically this is your second rib. So how you identify this is your second rib or first rib? Okay. always remember the second rib have some features, okay, some peculiarities features. So you can tell this, this is the second rib. See, this is mainly your upper surface, okay, this is the upper surface or outer surface, okay. Here you can see one rough structure is present, okay, tubercle present, okay. This is mainly present in second rib, okay. So by looking this one, you can tell the, sir, this is your second rib, or this is my second rib, okay. Similarly, here posteriorly you can see the head, constricted neck, and tubercle present, and angle present. Always remember the angle are quite closer to your tubercle in case of the second rib, but in case of the typical rib, they are 5 centimeter away from the tubercle. So this is the very important features of your second rib. So if examiner asks, can you tell two peculiarities of this bone and how you identify this is your second rib or not, you can easily tell, sir, in the upper surface middle one rough area or tubercle is present, okay, and in the tubercle the angle and tubercle are close each other. In case of the typical rib, they are not close, they are 5 centimeter away from the tubercle, okay. And see, this is your outer surface, this is the inner surface. So how you identify this is your left side or right side, okay. First you put it on table. See, the anterior end and posterior end are present in the same plane, okay, and they are touched to the ground. So this is the left one mainly, okay. And always remember the inner surface is smooth, quite smooth, okay. See, there are no tubercle present, but this is the outer surface. This is some ridge or rough surface is present. So this is the your outer surface, this is your mainly inner surface, okay. In the inner surface you can see one costal groove is present in the posterior end. Only present the posteriorly, not present the anteriorly, okay. In the inner surface you can see in the posteriorly one groove is present, okay, by which the intercostal vessels and nerve are passed. VN structure are passed through it, okay. This is the intercostal groove or subcostal groove, okay. So this is your anterior end and this is your posterior end, okay. So this is your left side, okay. If you hold it like this, sir, this is the right one, this is wrong basically, because see here the smooth surface is always the downward, means inner. So here to not the present the inner. So this is the correct way of identifying, okay. So this is the anterior end, this is here some depression present by which this is attached to your own costal cartilage, this is second costal cartilage, okay. And here you can see here upper and lower two facets are present by which this is attached to your mainly vertebra, second thoracic vertebra, okay. Now you can see here this is the anterior end and posterior end having head, constricted neck, tubercle, and another is angle, okay. So now you have to see here. So the second rib is flat, okay, and always remember it is curved like the first rib, okay. So curve in so the second rib is flat and curved, that parts of your thoracic cage. The second rib, when you place on the flat surface, that entire ribs is touch your surface, okay. So in the typical rib, the posterior end is lift off, okay, like this. So in the second rib, this is attached in the same line, okay. But in case of the typical rib, they are lift off posteriorly, okay. So this is the one features of this second rib, that the ribs is not twisted, okay, but the typical ribs are twisted. So next is your anatomical position, okay. See, this is the external surface is always directed outward and upward. So this is your external surface. See, this is your external surface. This is always upward and outward, okay. And near the middle, one prominent rough area is present. So this is this identifying feature also the second rib, okay. So in the anatomical position, you can hold it like this. The external surface is outward and upward, and in the middle of it, one prominent rough area present, and the inner surface are smooth, and it is present medially and downward. And here you can see one groove is present, short costal groove is present here. It is mainly present posteriorly. So this is the basically the anatomical position. Okay, and outer surface is always rough and the inner surface is smooth. Okay, see here, this is your head. Okay, this is mainly your posterior end. Okay, this is the head, this is the neck, constricted neck, and one tubercle is present, and this is the rough area. Okay, and this is the anterior end, and here you can see the outer border and one upper border is present. Okay, outer border and upper border is present. Okay, next is the features. So always remember the second rib, its by length is twice from you as compared to the first rib. Okay, see here the first rib is small. Okay, and the second rib is twice the first rib. Okay, and the first rib is also some thickness are present, quite thick as compared to the second rib. So the second rib is thin as compared to your first rib, and by length it is double. Okay, as compared to your first rib. And the twisted area is absent, means this is not the twist, so twist is absent in the shaft part, and the external surface of the shaft is faces upward and outward, and the inner surface are smooth and curved and faces downward and medially. Okay, and the angle is close to your tubercle. So this is the some very much important features about your second rib. Now the muscle attachment. Okay, always remember only 3 muscles are attached in your second rib. One is your serratus anterior. Okay, can anyone tell me how many digitations are present in your serratus anterior? Yes, 8 digitations are present. They all are originate from your 8th rib. Okay, first to 8th rib. Okay, so previously you see the serratus anterior muscle, upper part of the first digitation are origin from your first rib. Okay, so here the remaining, the lower half is origin from your this area, this tubercle area. Okay, which has been present the medially, means middle of the outer surface. Okay, yes, mainly the rough part. Okay, so here the serratus anterior muscle is origin first part of the remaining half, means lower half of the first half and the whole digitation of your second. Serratus anterior muscle is originate from this rough area, means this tubercle area. Okay, and see here another muscle is present here. This is Scalenus posterior. This is mainly your neck muscle. Okay, the Scalenus anterior, posterior, middle. Okay, so this is mainly your neck muscles, and this is origin from your, you see here behind the tubercle, here one ridge present. Okay, ridge behind the tubercle. This is the rough area, this is the tubercle, and behind this, okay, one ridge present. From anterior of the ridge, the Scalenus posterior muscles is attached, and the posterior of the ridge, the serratus posterior superior muscle is attached. So the serratus posterior superior muscle is basically your back muscle. Okay, so serratus posterior inferior also muscle there, so superior and inferior. So here the origin from the serratus posterior superior muscle. Okay, so in the rough area, the serratus anterior muscle first and second digitation are originated, and behind the rough area you can see there are one tubercle or ridge is present. Anterior to the ridge, Scalenus posterior muscles is originate, and the posterior to the ridge, serratus posterior superior muscle is origin. So see the attachment. The outer surface of the prominent tubercle gives attachment to the lower half of the first digitation of the serratus anterior and the entire second digitation of your serratus anterior muscle. And see the behind the rough and prominent tubercle, anteriorly Scalenus posterior muscles is attached, and posteriorly serratus posterior superior muscles is attached here. So serratus anterior muscle having 8 digitation. Okay, first one is attached to your first rib. The upper half of the first digitation is attached to your first rib, and here the lower half of the first digitation and the entire second digitation is attached to your this second rib. And behind the prominent tubercle or rough area, you can see there are one ridge like structure is present. Here anteriorly your Scalenus posterior muscles is attached. The Scalenus posterior, anterior, medial, this is mainly your neck muscles, and the posteriorly Serratus posterior superior muscles is attached. This is mainly the back muscle. Now the relations, the inner surface, always remember, because this is present like this. So the inner surface is, see here the relation, the inner surface, what structure present? Lung, and covering your lungs mainly. Okay, so this is the relation of your inner surface mainly. Then next is your articulation. Okay, see in the tubercle, this is the mainly tubercle your, okay, this is the head, this is the constricted neck, and this is the tubercle. Okay, see in the tubercle there are two parts is present. Medially, one is articulation and another is non-articulation part. Okay, so this is your lateral side, this is your medial side. Okay, so medially articulates portion, this is mainly articulates to your the thoracic vertebrae. Okay, when you have the class the thoracic vertebrae, these things are taught. Okay, now you only remember these things only. Okay, that the tubercle having two parts, one is articulation, another is non-articulation part. The articulation part is present medially. Okay, and this is attached to your costal facet of the transverse process of the second thoracic vertebrae. Okay, and another is laterally non-articulate portion is present. This is attached to your tip of the transverse process of the second thoracic vertebrae. Okay, so this is mainly the tubercle portion. So it's having two parts, one is medially articulation, another is non-articulation parts which is present laterally. In the exam point of view, you have to know the basic things only. First is the how many pairs of ribs are present, the classification, then intercostal space, intercostal muscles. Okay, then vein, artery, nerve. Then here in the ribs you can identify the main features. Like in the second rib, the main features is the outer rough area is present. Okay, one tubercle also present, and the inner surface is smooth, and posteriorly the subcostal group is present. Okay, and the angle is quite nearer to the tubercle. So this is the main features. You have to remember the main things. Okay, see here, this is the head. Here two facets is present, one is upper and lower. The upper and lower are articulates with your first and second thoracic vertebra, and from costovertebral joint. Okay, so this is your left side, so this is articulates like this only. Okay, your thoracic vertebra, and from the costovertebral joint, and the anterior end is articulates with your second costal cartilage and from costochondral joint. Okay, so in the articulation point of view, you can see in the tubercle part, one articulation and non-articulation portion is present. This is mainly attached to your thoracic vertebra. Similarly, the head also attached to your mainly the first and second thoracic vertebra by presence of upper and lower facet, and the anterior end is attached to your second costal cartilage, by which this is attached to your sternum bone, and from costochondral joint. So next, the function. So what is the function of the rib cage? So this is protects your heart and lungs. Okay, and expand when the lungs is breathe. Okay, so this is the main function. So this is quite small topic. Okay,